Hi friends, how are you all? I'm back with other video. This is Sushma from Serena Healthline channel. In my previous video, I discussed with you regarding the hypertension causes, types and symptoms. In this video, I want to discuss with you regarding the dietary management. So before starting the dietary management, I want to discuss with you the dietary principle for this hypertension condition. You all know that hypertension is nothing but elevated blood pressure. So, the dietary principle for hypertension condition is low calorie, low fat, low sodium, normal protein. This is the dietary principle. Coming to the energy requirement, for the obese individual, if he is sedentary worker, only 20 kilocalories per kg body weight is suggested. Or if he is moderate worker, 25 kilocalories per kg body weight is suggested. Next, coming to the protein requirement, 60 grams of protein is given for proper nutrition. If he is severely hypertensed, then in severe hypertension condition, as suggested by Kempener, only 20 grams of protein is suggested because all protein rich sources are rich in sodium. Earlier, Kempener's fruit diet was suggested, but it was deficient in many nutrients and nowadays it was not followed. Coming to the fat requirement, as hypertensive patients are more prone to heart diseases like atherosclerosis, low fat diet is suggested. Only 20 grams of fat is allowed. Out of that, animal fat should be avoided and vegetable oils is permitted. And omega-3 fatty acids plays a great role in decreasing the blood pressure. So out of that 20 grams, only omega-3 fatty acids like unsaturated fatty acids, PUFA, MUFA are suggested. Now coming to the sodium, as I told you in the dietary principle, low sodium diet is given. If the sodium is taken more, our cellular water will be more because the water retention is more. That will increase the blood volume, that leads to increase in blood pressure. So moderate sodium, that is only 2 to 3 grams per day, will decrease 6 to 10 millimeters of sodium. And if according to the American Heart Association, so for mild hypertension 2 grams per day and for moderate hypertension 1 gram per day of sodium is suggested. The normal requirement is usually not for hypertension patients. For normal patients, the requirement of sodium is 6 to 7 grams. That is 1.5 teaspoon per day is allowed. Because he is hypertension, there should be low sodium. So the sodium should be restricted. So do not use salt at the table, salt in the dishes, and avoid monosodium glutamate. Monosodium glutamate is nothing but Ajinomoto, that is also called as tasting salt, which is used in fried rices, biryani, noodles. So please avoid that and avoid sodium benzoate. It is added as a preservative in jams and ketchups. So you need to avoid that and avoid frozen peas and avoid pappets, pickles, shellfish, dry fish, jams, jellies. These should be avoided and avoid all the bakery foods because these all contain high amount of sodium which need to be restricted. Coming to the potassium requirement, if there is low potassium level in our body, that will increase more sodium level in our body. So if the sodium is increased, there will be more water retention, that leads to increased blood pressure. So that the potassium levels need to be increased. So per day 3500 milligrams is suggested. So this can be available by taking more amounts of fruits and vegetables that will provide liberal amount of potassium. Next, coming to the calcium. Research says that if there is high amount of calcium can decrease the blood pressure. So take high calcium rich foods like milk and milk products, ragi and some sort of leafy vegetables and meat products. And next, coming to the requirement, DASH diet. I told that previously the Kempener fruit diet was used to be suggested, but now the diet was changed, that is DASH diet. DASH diet is nothing but dietary approach to stop hypertension. In this diet, so inclusion of fruits and vegetables, more fruits and vegetables should be included, and low fat foods. Fat foods should be reduced, low amount, and low fat milk. Inclusion of fish. You know that fish is a rich source of omega-3 fatty acid. And last point is low amount of sodium. So DASH diet includes more amounts of fruits and vegetables, low fat milk, low fat foods, inclusion of fish, and low sodium foods. This is the DASH diet. So if you follow the DASH diet, then the hypertensive condition can be improved. So this is the dietary management for hypertension patients. If you strictly follow this diet, your blood pressure levels can be decreased. As I told you, the normal salt intake is 6 to 7 grams. Please try to avoid the foods which are rich in sodium. So if you like my video, please like, share and subscribe my channel. I'll be back with other video which will be useful for you. And please click on the bell icon where you can receive my new latest notifications and updates regarding my channel. Thank you very much. Bye.